Hello, welcome back to this channel. We'll be discussing today diabetes, and today being World Diabetes Day, it's appropriate that we talk about diabetes. We all have heard about diabetes mellitus. But what is diabetes mellitus? Diabetes is a lifelong condition or a chronic condition where there is high blood sugar level. Why is there high blood sugar level? Because it's either there is no insulin or too little insulin to be able to metabolize the glucose into glycogen. And so the end product of digestion of carbohydrates, which is glucose, stays in the blood. That's what it's called high blood sugar level or high blood glucose level. This insulin are produced by beta cells of islets of Langerhans of the pancreas. They are produced by islets of Langerhans of the pancreas. And so because this insulin, either this pancreas or the islets of Langerhans of that pancreas are destroyed, the person will not be able to produce insulin, or we all produce too little insulin to be able to do what? Convert glucose to glycogen. And so there's high blood glucose level or high blood sugar level. So there are two types of diabetes, mainly the type 1, which is called the insulin dependent diabetes, or the type 2, which is called the non-insulin dependent diabetes. In type 1 diabetes, which is insulin dependent, literally means the method of treatment is giving insulin. But you can use other methods like diet, exercise, which are essential also. So we use the acronym DIE, D-I-E. But the one in the middle, the I, which is the insulin, is very, very important for type 1 diabetes. It's also used to be called juvenile diabetes because it's mainly occurs in the younger ones, in children. You really identify that the younger ones. And so they are being given insulin to treat their diabetes. Then the type 2 diabetes, which is called the non-insulin dependent diabetes, simply imply insulin is not usually required because these people, most often, they have a little bit of insulin or they may have insulin resistance. And what causes that insulin resistance? You'll find that because there's high blood glucose level, high blood sugar level, the muscles, because insulin is needed to convert glucose to glycogen, and glycogen are stored in the muscles and the fatty tissues in the muscles. We need them. So with this insulin, that's where the muscles cannot store that insulin and that glucose because it's still up in the blood. So they have this insulin resistance, and then the blood sugar level goes up high. We also have other types of the type 2 insulin is also referred to the adult onset of diabetes. We also have other types like pre-diabetes. Pre-diabetes is when the person's blood sugar level are above normal, but they haven't reached that level of becoming very high blood sugar level. So the person is called pre-diabetic. But at the end time, most of them end up having type 2 diabetes. There's also a type called gestational diabetes. Well, the term gestational means with pregnancy. That means diabetes in what? Pregnancy. You see a pregnant woman becoming diabetic. Sometimes, some of them after delivery, they all go to develop type 2 diabetes. But some of them, when properly managed, it's being well controlled. So what are the levels of blood sugar that you will say, okay, this is high blood sugar or this is low blood sugar? Because we have two types, hyperglycemic and hypoglycemic. But now let's look at when there is hyperglycemic. What are the symptoms or signs and symptoms when you see when a person is what? Hyperglycemic, or signs and symptoms generally say signs and symptoms of diabetes. There are three signs of diabetes. 3 P's, classical P's of diabetes. One is polyuria. And what is urea? Urea is passing out excess of urine. So there's polyuria. when the person pee a lot. The person pees a lot. And then there's what? Polydipsia. Imagine when you pee a lot, what will happen? You get thirsty often. So polydipsia, you see the person drinking a lot of water, fluids. Yeah, because he's peeing a lot, he's losing fluids. He wants to replenish that fluid. So the person is what? Thirsty and is drinking a lot. We also have polyphagia, excessive hunger. Literally, the polyphagia means excessive swallowing. Yeah, but in terms of this, it means excessive hunger. And you see them getting hungry, eating excessively. That's the three classical P's of diabetes: polyuria, polydipsia, and polyphagia. Sometimes they are ill. They lose weight loss, loss of muscle tissue, muscle bulk. They lost the muscles, they lose weight, they are ill. Some of them develop itching. They develop oral candidiasis or vaginal candidiasis because it's a chronic condition. The glucose levels are high, and you know candida has affinity for glucose, and so they have this candidiasis, vaginal candidiasis, or just oral thrush or thrush. Literally, they have it. So these are signs and symptoms of someone that is diabetic. That's why we need to go for checkup to test if we are diabetic or not. We need to continually check ourselves. So the blood sugar level now, when somebody is said to be hyperglycemic, that means their blood sugar level is very high. The person will have a level of above before meal, and then like you're doing a fasting blood sugar before meal in the morning, like 6 o'clock, before the person has eaten anything, and the blood sugar level is above 7 millimole per liter, or it could be above, depending, above 70 milligram per deciliter, because yeah, millimole, you just multiply by 18, you get milligram per deciliter. So some people use the range of millimole per liter or milligram per deciliter. So when a person is above 7 millimole per liter before meal, or say fasting blood sugar, then the person is said to be what? Hyperglycemic. Or when the person have eaten and is having a blood sugar level of above 8.5 millimole per liter, the person can also be referred to be what? Hyperglycemic. And so what do you do when a person is hyperglycemic? You encourage a person to take water, enough water, encourage a person to take his or her medication if he's on insulin or oral oral anti-diabetic medications. The person should take it. What of hypoglycemic? Hypoglycemic. That is very dangerous. One thing we don't know, we all talk about hyperglycemic, the blood sugar level is so high, but it's quite dangerous when the blood sugar is low. Hypoglycemic, when you check it, like maybe person before meal or fasting blood sugar, and you've got a level of 4 millimole per liter, or you got a level that is less than 50 milligram per deciliter, is a medical emergency. The person can go into coma immediately. So what are the signs and symptoms when the person's blood sugar is dropping? You see the person being what? Feeling like he's fainting, like person is going down, sweaty, palpitation, trading increased pulse rate, respiration is rapid and stuff like that. The person respiration is dropping. It will start from rapid respiration, and then as person continues going low blood sugar, the respirations are dropping, the pulse remains so high, sweating, shivering, cold. That's the symptom that person has hypoglycemia. And what do you do when a person has hypoglycemia? If that person is still conscious a lot, you need to give that person something like simple glucose, 15 to 20 grams of glucose. Like you give the person a fruit juice, or you have a glucose tablet or glucogel. You give that person and recheck that blood sugar again. Within 5 minutes, recheck it and continue another 15 to 20 grams of carbohydrate. You could be giving the person like normal carbohydrate, like giving the person sandwich to take, or milk, a glass of milk to take, and simple like that. Then you continue to check the blood sugar level. At the same time, you can transfer that person to the hospital, take that person to the hospital for proper management to find out what is the cause of hypoglycemia. And what we don't know is that when we going out for an exercise, Maybe the person is on insulin dependent, has insulin dependent, which is type 1 diabetes, and that person is going for exercise. That person needs to eat, because exercise is like insulin. You're burning out that glucose, your blood sugar is dropping, you've taken also insulin injection. What do you expect? The person can become hypoglycemic. So encourage that person to eat before going out for that. So in type 1 diabetes, I said the acronym DIE. The I in the middle is the insulin, which is very essential. That is the proper treatment for type 1 diabetes. Then in type 2 diabetes, you use DOE. 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 So D for diet, O for oral anti-diabetic medication, such as metformin. We all know metformin, glibenclamide, or sitagliptin, all this stuff of medications. And the second one is exercise, which is essential. Mind you that exercise in type 2 diabetes is also essential, because the most common cause of type 2 diabetes is obesity, because it's an adult onset. Most of them that have that obese come down with type 2 diabetes. So they need to go in for regular exercises in order to do what? Lose some muscles and some fats. Check your BMI, basal metabolic rate. You need to know your height, you need to know your weight, especially check your waist circumference, which is essential. So these are the treatments that can be done for diabetes. So people will talk about diets. What diet shall I eat when I'm diabetic? We have diabetic diets. I'm not a dietitian or a nutritionist, but I advise your diet will depend on your blood sugar level, on your age, on your level of activity. And you need to incorporate the classes of food that we have, be it the carbohydrate, the starchy food. But when you're going on for the carbohydrate, ensure that you take a low glycemic index carbohydrates. Not the ones that will shoot up your sugar level, but the ones that will gradually increase your sugar level. You could eat whole grain, the proteinous food. You could take up the beans, the lentils, the nuts, the protein. Also, you could take up the milk, the dairy. Don't go for the high or the saturated fats. You could take olive oil for your meals, milk, the yogurt, the cheese, but don't go for the highs or the saturated fats. Incorporate fruits and vegetables is essential. Also, when you're taking fruits, find fruit that has a low glycemic, that's a low carbohydrate content in the fruits and vegetables you're eating. So just combine the classes of food and take more water. Water is essential. Yeah. So there are also proper treatments also that people have been going on. Researchers have been going on for treatments for diabetes. Some researchers do islet of Langerhans transplant. That is, the islet of Langerhans is in the pancreas. So they do a transplant, because in people with type 1 diabetes, we find out that most of the times their body attacks their pancreas. And so when their body attacks the pancreas produces the insulin. They cannot produce insulin anymore. So sometimes the surgical management is to transplant the islet of Langerhans, or to transplant the pancreas itself for that person. Some go for gene therapy, just remove the faulty gene and replace it with a good gene. So these are researches that are going on for the treatment of diabetes mellitus. So what are the complications of diabetes mellitus, we may ask? Because diabetes mellitus has its own complications. One, there are many complications also. It can cause heart diseases, stroke, which is cerebrovascular accident. It can cause stroke for that person. It can cause eye problems like diabetic retinopathy, leading to blurred vision, to blindness. It can cause kidney problems, kidney or renal retinopathy. The person comes with different types of kidney diseases, chronic kidney diseases, end-stage renal disease, all these stuffs. It can also cause diabetic foots, because another sign you can see when somebody has diabetes is that their wound does not heal faster. It takes time for their wound to heal. And so they come up with chronic foot ulcer. These are many causes. It can shoot up your cholesterol level, hyperlipidemia. These are complications that can result from diabetes. So, in as much as we are controlling our blood sugar level, we're also limiting these complications from happening to us. So let's take care of our health today. That's what I'm gonna advise us. Let's take care of our health. Let's eat adequate diet, exercise, go for health checkups. Go ahead for health checkups. Because in this country, if you're in the UK, 90% of people with diabetes have type 2 diabetes. And globally, every 2 minutes, someone is being diagnosed with diabetes. So you can also go to this website that says RiskScore, www.riskscore.diabetes.org.uk, www.riskscore.diabetes.org.uk, to assess your risk of having diabetes. It's very essential. Bye.